Hi, this is Eric Stoller here for the Eric Stoller Show and the Patient Zero Series. We're here at the Med Spa Conference 2024. I'm here with Dr. Faheem Inayatali from the Dry Eye Wellness Center based in Sugar Land, Texas. Dr. Inayatali, thank you for being here. And tell us a little bit about the clinic. I hope I didn't botch the name too bad.
Pretty good.
Pretty good.
Yeah.
Tell us a little about what you do. And I know you're here for this conference, kind of looking on how you can scale your business. But tell us a little about what you do in Sugar Land.
Yeah, it's a pleasure to be here. Thank you for having me. So we founded the Dry Eye Wellness Center. Initially, the premise is to treat moderate to severe ocular surface disease. You know, patients have been suffering for years, haven't quite had the relief with artificial tears, and it gets quite debilitating at times, and to the point where you don't really have any answers, and it affects your quality of life. So we started off with mainly that dry eye disease to be able to treat that, and we noticed there's a lot of comorbidities. There's a lot of patients that have other disease and conditions that they'd like to treat as well. And of course, there's a cosmesis aspect. When you're rubbing your eyes for 10 years, you get a lot of wrinkles and bags under your eyes, so there's a lot of cosmetic a lot of rosacea that occurs on the eyes and the face. And so there's a lot of patients that requested additional services.
Interesting.
So we got a chance to explore, expand, and broaden our scope of practice to be able to treat aesthetics and wellness, everything from weight loss and hormone therapy to microneedling and hydrofacials and chemical peels. So we got a chance to really broaden our scope, and we implemented a lot of nutrition and biohacking, and patients love it. Patients love the one-stop shop. They also, all of these things are tied with one another. The same blood vessels that run through your eyes run through the rest of your body, and you have to be healthy overall, and our goal is just optimization of people's health and get them back on their feet and back on track in the right direction.
That's phenomenal. And so let's talk a minute about about the dry eye syndrome. I suffer from rosacea. I know, obviously I have some issue with the dry eyes, but I know also there's been a lot of other detections through the eyes of diseases or whatever, illnesses that somebody has. Can you expand on that?
Absolutely. There's about 246 diseases that you can catch in the back of the eye.
Wow.
Everything from colon issues to cholesterol. There's a few patients that I've detected tumors that are actually pituitary in nature, which are in the back of the brain. And there's a lot of different diseases you can catch from the eye. Rosacea, as you mentioned, there's acne rosacea, then there's ocular rosacea, two similar aspects, but it all comes down to the inflammation and those red blood vessels kind of creating trouble and causing disruption in the tears on your surface of your eyes. And it can be debilitating because ultimately, if you let dry eye kind of ponder over time, just kind of diminish your health of your eyes over time, eventually it can affect your vision and clarity. And you only have two eyes. That's a very important organ.
Yes.
So you want to take care of that, and you obviously want your health to reflect that. So I always tell patients, if something's bothering you, something doesn't feel right, even if it's just watery eyes, or you have rosacea on your face, or you're a little bit overweight, just go to a holistic center that can get you checked up in and out, everything from hormones to your ocular surface, and be able to try to track down the source of the problem rather than just treating it, treating the symptoms with over-the-counter Band-Aid effects.
Sure, no, that makes a lot of sense. And so as your practice expanded, did it happen where patients requested other types of services, or you said, hey, let's bring this into the clinic? Or was it more patient focused and then you brought in the services?
A lot of my research was basically detecting what coexists with dry eye disease.
Okay.
And it turns out that, everything from testosterone levels to your weight management, which has to do with insulin resistance and inflammation in your body, to other comorbidities like diabetes and even screen time. All of this is related to one another. And so we call it computer vision syndrome, because the more you're on your devices, everything over 3 hours, you're basically blinking about a third of what you'd usually be blinking. So, and that means if you're not blinking, you're not really creating that surface layer of tears.
Interesting.
And so we noticed that these patients are suffering from one or more conditions, and we're able to internally refer to our other providers in our office, and they can get everything from Botox to fillers to hormones. And it's a great feeling once that patient who's deficient in their testosterone levels, whether it's male or female, you change their life immediately, and everything
Yes.
seems to fall into place. So hormones basically guide your aging, and if you can figure out a way to make sure all of that's optimized, then you're going to age gracefully.
Yeah, and you make a good point, because a lot of people struggle with that. Not only men, you talk about testosterone, you're thinking men, but in today's day and age, a lot of women, I know they hit a menopause, and you have the estrogen and the testosterone, and they're getting the prescription for both. So it's for both. And again, one of the doctors I talked to yesterday, he's been on testosterone for 20 years, and he's 62 years of age. And you don't realize, listen, as you get older, your body starts changing. What do they say? Old age isn't for wimps, right?
Right.
Right. So here you're here at this conference. What attracted you to come to this conference?
I went to, I had the opportunity to go to a prestigious business school, and it helped quite a bit to be able to understand scalability, to be able to ensure that patients are getting consistent care. And you do that by, having a profitable office. But there's always things and aspects you can learn from other people, and being around like-minded individuals, being around coaches and mentors. I feel like you can never stop learning. You're always going to be a student. So even in business school, there are certain things that you just don't learn.
That's true.
And I think that the more you're around other offices that are successful, the more you can enhance your own patient experience in your own office. And having that quality of care while growing the office and expanding, the only way to really successfully do that is to surround yourself with other individuals who have been there, done that, and are willing to share their knowledge and information.
Yeah, and you make a good point, because here you've got, somebody like April, who's got a lot of knowledge, and, is sharing a lot of stuff with people. And again, I said earlier, you're a healer, right? You're here to help people. And then you have the whole business side of your practice that you have. And I know we talked a little bit, you have a nurse practitioner that runs your weight loss program. Well, I know she wasn't here with you this weekend. But again, so, it is a fine line of balancing. So how do you, as a practitioner, how do you balance that? I know you work a lot of hours, and then you took your time for this weekend to be here, and then you're going home to be home with your family, and I'm sure it starts all over again on Monday morning. So how do you manage all that?
So I think delegation is key, understanding that you have to set your boundaries on work. And by the end of the day, obviously you have to put in the hours, but it's an investment, because if you can use technology to create self-sustainability in the office, have the proper people by using technology to find those people to run the office and do what they're passionate about and what they're able to do on a day-to-day basis. I think that helps create that balance. And sometimes that becomes a little lopsided if you lose some people, or if they have to go, either back to school or whatever it may be. So it can become lopsided. So I think it's important to understand the fundamentals of the business side and have that balance. But I think ultimately the goal of any business person should be, how do we create an environment where you can think big picture and create that big vision, and not have to constantly worry about the micromanaging aspect.
Yeah, and you make a good point, because I've had an opportunity to work with a lot of doctors. I've gone into business with a number of them, and it is because it is such a specialized, and there's so much knowledge that you need to have as a doctor. And then there's some of that, hey, I now have to transfer the skills and be a business professional. And you hit it, because a lot of people can't delegate. They're afraid to delegate. I try to coach one of my business partners, and he's like, he couldn't let it go because nobody could do it better than him. Right. But if you can, I used to say, when I used to run sales organizations, I said, my job is for you to fire me and somebody to take my position. And they go, why do you do that? Because I'm trying to scale the company. If I'm sitting here, then I'm not doing my job right. I have to replace myself, and replication is the hardest thing. So how do you incent your people? How do you keep them motivated to work with you? And, obviously you're expanding, you got a lot of different things you do. How do you make that happen?
So I let technology help incentivize. We use a protocol, a platform called Reward Zone, which basically incentivizes our staff to align with our office goals.
Okay.
And they're able to trade in some of those points that they achieve for experiences. And it's a fantastic program. That's one way. The other way is we use open book management, which I think has been very helpful to create ownership from our employees and our staff and what we call team members and family. And they're able to know what comes in and what goes out and what it actually takes to run a business.
That's great.
And that's not common. You don't see that in most practices because most owners want to keep some of the numbers to themselves. And we don't share staff numbers like individual salaries, but collectively, what is our salaries? What are we spending on?
Right.
And it's an eye opener because it's not so glamorous always on the inside as it seems on the outside.
Yes.
And being able to provide that awareness and insight allows our staff members not just to look at, how can we improve our revenue or how can we get patients to come through the door, but also how can we save a little bit on expenses? Maybe we don't need to overspend on certain aspects of the office and really focus on profitability. And that's what our staff is really incentivized based off of.
And you make a good point because, when you're hired people and they're only getting an hourly or a salary and they have no incentive to the bottom line, they don't care if they're like, hey, we're over ordering something or ordering something we never used, but we just keep ordering it. So, yeah, I think it's great because now your team is empowered to protect the house, right? And when people, I always work for people that, they let me come in and say almost as a partner, but I was willing to work on the profits and risk it. Because I know if I gave it my all, the upside would be, so I treated the business, hey, we're going to save money here, cut here. And that's really, when you get empowering people to act as if they're president of the company, it's really an amazing thing. I commend you for doing that because a lot of people don't do that. It's all about them and the ego, right? And, and everybody, assumes that doctors are all making a lot of money. Mm-hmm. And even if you make a lot of money, there's a lot of expenses and there's a lot of legalities and people don't realize medical is one of the most litigious businesses, right? Mm-hmm. And dealing with eyes and things like that, very sensitive. So tell me also, let's kind of shift for a second, the weight loss business, because weight loss is the biggest boom out there right now. You know it. And so tell me about your weight loss business and how's that progressing and, with your team.
Right. So I think we wanted to first differentiate ourselves. We didn't want to commoditize weight loss. I think that, I think Amazon and Sam's and Costco and all these different companies are entering into the weight loss business. We wanted this to be more doctor driven. We wanted it to be more science based. We wanted it to be very trackable, with 3D body scans and make sure that they're actually, getting where they need to be. We wanted to have a coaching program with nutrition. We wanted to use all of the biohacking capabilities, at least that I've learned over the past 12 years, to be able to implement that and to be able to really achieve success and accelerate some of that weight loss safely but effectively.
Yes.
While also keeping that skin tight and not losing muscle. And I think that's one of the biggest problems with weight loss right now is you are able to tackle the fat part of it, but you're not really thinking too much about, you don't want the muscle to be decreased more than 10%.
Yes.
You don't want to have that skin laxity by losing so much weight so fast. So you really need to be able to address all three of those layers to make sure that you're in a good place. I've read that and I've researched that essentially old age, the best predictor of good health in old age is the amount of muscle mass you have. And if you're losing weight very quickly on semaglutide, you're really not protecting your muscle, and you're going to be losing muscle regardless.
Yeah.
So I think one of our priorities and what differentiates us is how can we create a safe and effective program that makes it so that you don't have that rebound effect as much.
Yeah.
And that also it's a lifestyle sustainability of nutrition, making sure that you're building muscle, you sleep better, you have better habits and behavior by the end of the program. And then we also look at medical aspects such as cholesterol, blood pressure, C-reactive protein, which is inflammation. We're looking at all of those elements that are important to longevity, rather than just looking at how many pounds on the scale did you lose.
Yeah, and you make a good point there. I'm one of those people that started the weight loss, had some great results, now heavily in the gym, work out with a trainer, now really working, because I've been lifting weights my whole life and working out, and I go, okay, I'm seeing where I'm losing a little too much, and I love exactly what you're saying, because at some point, you want to make sure that you may get off the semaglutide, right?
Right.
But you want to be back to, hey, I'm doing the basics. I'm on my right diet. I'm working out. I'm doing proper things. The sleep, I think, is a big part of it. Mm-hmm. And I know for me, it's been a huge, huge reset, in that regard. So if people want to get a hold of you, they want to connect with you, they want to find out more, how do they do that?
Yeah, so we're located in Sugar Land, Texas, as you mentioned earlier. We're called the Dry Eye and Wellness Center. I encourage you to view our website with all the various services that we have. We're on Instagram as well. It's at Dry Eye and Wellness. We have all of our information online. I encourage you to visit us. Our consultations are complimentary, just to get a couple of words in with our providers who can really get you to understand and coach where you want to be, what your goals are. And everything's very tailored for our patients. There's no cookie cutter approach. We want to make sure that you're getting the results that you need by understanding your physique, your body chemistry, making sure that you're progressing the way you need to be progressing, again, safely and effectively. Whether it's dry eye disease and you want finally you want to get some relief from that horrible disease, or if it's something where you just want a complete facial rejuvenation through a Morpheus 8 program. So whether it's something simple or more complex, we're going to be here to coach you along the way. So I encourage you to visit us online, and we have patients traveling from all over the US and Canada to come see us in our expertise.
Yeah, you got Sugar Land, Texas. Really, it's basically you fly into Houston,
Just
right?
a suburb.
Easy to get to.
Very easy.
And so there you have it. I appreciate it, Doctor, for coming in today. Dr. Faheem Inayatali, the Dry Eye Wellness Center in Sugar Land, Texas. This is Eric Stoller with the Eric Stoller Show, ericstollershow.com. Find out more about this interview. Before we wrap up, doctors, any last word you want to share before we end this interview?
No, I encourage everyone to just, try to listen to their bodies. There are ways to optimize their health. Everything doesn't have to be medically driven. You don't have to just put drugs in your system. I think there are ways, I know that there are ways to optimize your health just, without medicine, but actually listening to your body and finding providers that can actually help you guide that process.
Absolutely. And you sound just like one of those that cares about people and helping them live longer, live better. And so I thank you for doing this interview with us.
My pleasure.
And thank you, sir. Safe travels back to Texas. This is Eric Stoller signing off for this interview.